Hi, I'm Sarah Trott, and welcome to the Fourth Trimester Podcast. I'm a new mama, and this podcast is all about postpartum care for the first few months following birth, the time period also known as the fourth trimester. My postpartum doula, Esther Gallagher, is my co-host. She's a mother, grandmother, perinatal educator, birth and postpartum care provider. Fourth trimester care, our topic, is about the practical, emotional, and social support parents and baby require. And importantly, it helps set the tone for the continuing journey of parenting. Hi, this is Sarah Trott. Welcome back to the Fourth Trimester Podcast. We have a great show lined up for you today. I'm joined by my co-host, Esther Gallagher, and returning guest, Leah Keller. So we're so excited to have her back. We're doing a deep dive on Diastasis Recti. We talked about it a little bit in a prior episode that we had with her. So we'll link to that one in the show notes, but this is going to be really comprehensive. There are a lot of risks associated with doing things too fast, too soon after you have a baby. And so we want to make sure we inform you as a listener and the people who are perinatal supporters listening to the show so that you can really avoid exacerbating any issues and make sure that you're educated in a way that allows you to exercise and avoid some of these pitfalls. So without any further ado, I want to introduce Leah and just let you know that she is the founder of Every Mother. It's an app that has on-demand exercise to help support diastasis recti, yes, but also other issues as well. And I personally have used the app. I love it. I love that I can put it in my pocket and go on vacation and it comes with me. So I genuinely love it. I'm thrilled to have her back on the show. Leah and Esther, I want to hand it over to you, Esther, first, actually, to put any preamble that you want on this. And then, Leah, maybe you can introduce yourself a little bit more in your own words.
Yeah. Sure. Well, I learned of Leah and then worked with Leah when she was postpartum with her second child, which is a lovely, lovely thing to be able to do. I, too, had the app for a while. I loved that there were different teachers with different modalities or different modalities in terms of fitness, and that it just really covered every possible base and gentle, lovely music. Like everything about it is beautiful. And Sarah has given the best recommendation of all, which is it goes wherever you go. So I think that's wonderful. And also Leah was so generous in coming to the doula group and demonstrating hands-on and really teaching doulas who might have otherwise had very little connection to these really very important fitness parameters for pregnant and postpartum bodies we're working with. And so I'm going to be thrilled that Leah will be sharing today about what's appropriate when and how much and all the details involved. So, Leah, it's so lovely to see you again. And I'm so thrilled that you're on the podcast with us.
Oh, thank you both so much. It was such a pleasure last time. It was a couple years ago when we talked about preparing your body for childbirth. And now we're going to look a little bit more closely at that postpartum moment and how you can restore core strength, core function. And having gone through 2 births myself, I remember that feeling of like jelly, like, oh my God, like what even happened? Can I activate these muscles? Like everything feels so stretched out and loosey-goosey, but your body is resilient. It is powerful. And those same muscles that stretch to allow the baby to pass through your body will also regain strength and integrity. And this is something that I've studied. We've published in medical journals research about how to heal your body postpartum. And it's something I've personally come alongside so many women to help them one-on-one and in small groups find that strength, that deep muscle activation, that body awareness. And so I'm just really glad to be here today so that I can help share that same information and coaching and cueing that has helped so many women help you on your journey through recovery or through preparing for birth or wherever you are. And as we go, I'll also make sure to mention whether something is safe for pregnancy or this is better postpartum, etc. there's something for everybody here. And it's always good to know what's coming too. If you're anticipating your first child, like having a little window into that early recovery period will just be really beneficial. So thank you so much for this opportunity to be with you.
Yeah, well, we're very excited to go deep on this particular topic. Maybe we should start with the basics of what is the context around diastasis recti? What is it? What causes it? And what are the basics if someone's never heard of this term before?
Sure. So diastasis recti, and by the way, I'm just going to mention there are 2 correct pronunciations because this is one of the most common questions I get. They're like, how do you say it? So diastasis recti is one correct pronunciation. The other one is diastasis recti. And I learned first about this condition from someone who said diastasis recti, so that's how I'm going to say it. But you're correct, no matter how you say it. So anyway, that said, what is it? It sounds scary. It sounds intimidating. It is simply an overstretching of the connective tissue that runs up and down the center of your body. It's called the linea alba, and it's connective tissue that kind of connects the 2 halves of the rectus abdominis, which are also called your six-pack muscles. And we all have six-pack muscles, whether you're pregnant or postpartum, or you feel like I don't have any muscles in my core. You do have muscles in your core. And the rectus abdominis is the most superficial layer. That's not a judgment. It's the closest to the surface. It's the most superficial layer of your abdominal muscles. And during pregnancy, which is the most common cause of diastasis recti, things need to stretch and expand to create space for baby, to create space for the expanding uterus, to create space for the placenta. There's a lot of things going on here, a lot of growth. And so the body is wise. The body knows how to expand, and it will expand in many ways. You'll be stretching lengthwise. You'll be stretching in the circumference. Sometimes, and we have relaxin pumping through our bodies. Sometimes relaxin hits certain areas more than others. And that can lead to sometimes pain if the pubic bone is suddenly mobile. Sometimes we have SPD pain, and that could, that's just sort of unlucky if your relaxin hits you in that area. So when diastasis recti occurs, it means that there's a lot of stretching in that tissue. It's not a tear. If there were a tear, that'd be a hernia. So sometimes they can both occur, but a hernia is far more rare. Of the linea alba, more often it's just a stretching. And what we've learned through studies that are now published is that very specific deep core activation can help those muscles recover their strength and their elasticity and their integrity. It can also help the connective tissue return to its contractile strength. So where that tissue can become loose and sort of lax, sort of like cellophane or like plastic wrap, it can feel like that sometimes. It can also restore its integrity and become more like a rubber band. And that's what we do to help your body heal. We help those muscles regain strength and the connective tissue regain its integrity. It is really common. The most conservative published statistics are over 60% of a singleton pregnancy. So usually if there's a little, even if it's a mild or moderate separation, we also call this abdominal separation. Diastasis recti can also be called abdominal separation. Even if it's a mild separation that kind of lingers after that first pregnancy, women will often show sooner in a second or subsequent pregnancy because of some remaining diastasis recti. And if it's mild, there's usually not a big functional impact. You might not notice it. You might feel like maybe your clothes never fit quite the same after a pregnancy, but it might not be really hindering your movement. However, if it's more moderate to severe, you might start to have some physical repercussions. That might be back pain. It might be related to pelvic floor dysfunction. Sometimes when there's a lot of laxity here, other muscles over-recruit trying to protect and stabilize. And so there can be pelvic pain, tailbone pain, hip pain, back pain. It can also contribute to a lack of strength or tone that can manifest as some prolapse or some incontinence. So anyway, everything functions together. And the really good news is that once we start to retrain our bodies and remind our bodies how these muscles kind of are meant to support us and how they're meant to engage, they will start to respond to that. So with just a little boost in the right direction, your body will heal. And even if we're focused on one thing, maybe you're focused on not peeing, or maybe when you don't want to, maybe you're focused on diastasis recti, but whatever it is that you're starting to kind of remind those muscles how to activate correctly, everything gets better. And in my early days, so this, every mother grew out of my private training practice in New York City, where I worked mostly one-on-one with women. And my background is fitness. So I came to this not as a physical therapist, although I work with a lot of physical therapists now. I came from fitness, and I was helping women be active and healthy and move well during and after pregnancy. And in those early days, I sort of got a reputation in New York for helping women heal this condition that eluded many people. So women would call me from all over Manhattan. I went to Westchester to do like workshops for women. Anyway, they were like, help me heal this thing. My abs are like, everything else is fine, but my abs separated and I don't know how to do it. So I was like this little Diastasis Recti trainer going all over the city. When working, especially one-on-one with women, you start to become like a friend and you start to learn a lot more intimate details about their lives than if you're just in a group class. And so even though I came in to help them like heal the abdominal separation, as we're working together, they would start to say, you know what? Like sex feels so much better. Like I feel a huge difference. Like I feel so much pleasure. I feel less pain. My partner noticed a difference. Or they'd start to say, hey, I stopped leaking. And I'd be like, I didn't even know you were leaking, because they didn't engage me to like help with urinary leaking. But now this is also solved. And it's not that we were trying to solve this whole long list of symptoms, but in just helping their bodies relearn that sort of mind-body connection of how to activate your deep core and pelvic floor, everything starts to function better and heals. And, I just want to give you hope that's based in reality, evidence, and facts that your body will recover and you can feel better than you ever have. And sometimes, too, it takes a sort of journey through pregnancy and postpartum recovery to even understand parts of our bodies that we might have just not given much attention to before. So anyway, I just like, don't feel like this is the end of something, but this is the beginning of something that can be like a really healthy and thriving part of your life.
Leah, I have a question that occurred to me based on a client I had years ago. I'm going to ask it this way. Is it possible for somebody who may have, let's just say overexercised, I'll use that as the term, prior to pregnancy, can you induce diastasis non-pregnant, right?
Mm-hmm.
And B, is it possible to have your core be in a particular state where then if you're pregnant, you might induce diastasis recti? Just
Yes.
curious, because this particular client, they believed that they were going to have surgery. They were told that they were going to have surgery to correct their diastasis. And I was pretty sure that was not, and I don't know if I don't think I knew you yet, but I was pretty sure that was not the right solution. And you've proved it, that it's not the right solution with your work with the medical community, that this is almost always the better approach than surgery. But can you talk a little bit about just talk a little bit about the body in terms of how diastasis might also occur non-pregnant?
Yes.
If that's possible.
Yeah. I feel like there's at least 3 questions in there, but I'll start with, that's okay. I love it. So I'll start with, can diastasis recti occur in a non-pregnant person? Absolutely. Yes. And I've also worked with clients who were male, who had never been pregnant. One of them was a bodybuilder. The other one was like a very big CrossFitter, and he was a manager at one of my gyms. But anyway, so these are just 2 examples of men who had self-induced diastasis recti from repetitive, stressful sort of load on their linea alba. And if you've ever noticed a Men's Health magazine, like at the grocery aisle or something, I mean, no judgment if you notice them, but sometimes there's like, bare abs that have a sort of torpedo-shaped gully in the center. Now, they are clearly very strong, and those muscles are very strong, but however they were training, and maybe there's some genetic predisposition as well, but however they were training, they were also putting a lot of collateral damage on the connective tissue that lines the midline of the rectus abdominis. Now, you might notice there are some other men who have very strong abs and like a lot of definition, and it's more like a thin line down the center. Just in terms of connective tissue, that thin line down the center, that's almost like the zipper on my jacket, that is a healthier connective tissue. That's going to, like, that man, as he goes forward into his life and as he ages and maybe has less than, like he develops more body fat, et cetera, having that strong, resilient, very like elastic connective tissue will be better for him, better for his back moving forward than one who trained and kind of his connective tissue took some of the brunt of that. So that's just like one example where it's clearly not a pregnant person. But I have worked with a lot of women where they called me in to exercise with them during their first pregnancy. And this might be early on in the second trimester, which is typically before we see any separation of the abdominal wall due to pregnancy. And I've seen like sometimes significant DR, which to me indicates that most likely they had some separation of the abs prior to the pregnancy. And then once you're pregnant, if there's already some laxity, that will increase faster. One person in particular, this was one of my first clients in New York, and she was a really serious athlete. Like she had done gymnastics at Yale. Like she had like she's really, really strong. And when I first met her in her early second trimester, she did have like a borderline DR. Like it wasn't really deep. Depth is a very important indication, like how deeply my fingers sink into the gully between the two halves of the rectus abdominis. Depth to me tells me a lot about the damage level to the fascia and how long it will take to heal. Anyway, she had a moderate DR, but it was kind of suggesting to me this predates her pregnancy. When I rechecked her about 8 weeks later, just kind of like, let's make sure. And this was like 2008. This was when she was one of my first new pregnant clients who had DR when I met her. And I was like, well, let's make it our goal to maintain during the pregnancy. We don't want it to get any worse. And then afterwards, we'll heal it. Anyway, I check her about 2 months later. She's clearly bigger, like 2 months gestation, like this. She's expanded a lot, right? But then she's been doing her core exercises and I go to check her diastasis recti and she's closed it during the pregnancy. So as she's progressing in gestation, she's actually closed her DR and it's down to just like less than 1 centimeter and very springy, healthy connective tissue. I'm like, Christy, what have you been doing? She's like, well, everything you told me. I'm like, everything? And she's like, well, so she was actually doing a little extra like core compressions on her way to and from work. She took the subway. This is New York City. So like she had 12 minutes each way. So she was doing like 24 minutes of core compressions. And she's like, but I only do it Monday through Friday. Because then on the weekends, it's a whole different schedule. So I don't do it at all on Saturday and Sunday. But anyway, so just like diligence and consistency, she had actually closed. So she exceeded my expectations as a trainer. But that was also the first moment where I realized, okay, like we don't have to just say, okay, maintain this level during the pregnancy and wait to heal later. We can actually work towards healing. And so then I have had hundreds of clients since then. Some of them came to me in a second pregnancy or a third pregnancy, and there was existing like significant DR. And we didn't always fully close it during the pregnancy, but we did make improvements. Nice. And that just shows you how powerful those exercises are and helping the body understand and like trigger like a healthy response in the connective tissue and the muscles. So we aren't helpless, like pregnancy can bring a lot of surprises and there are some things that we can't control, but there are things where we can help set our bodies up for like a healthier birth and more strength and more sort of integrity in the tissue with simple things like exercise, breathing, etc. So yes, it can occur without a pregnancy. And I've also seen this in female clients who had not yet been pregnant. Usually it is exercise induced. So I had a high jumper who had a pretty wide but shallow separation. When it's exercise induced versus pregnancy, it's usually shallower, which tells me that it heals faster if it's shallow. It will change your sort of profile a little bit, like your waistline. So if there's a wide separation that's shallow, you might look like you have flat abs, but like no waistline, just kind of like an athletic build. And then once those muscles come back together, it will change dramatically your waistline, even if you had flat abs and they weren't protruding or something. You know what I mean? Yeah. And I also had a figure skater. It's usually kind of athletes, dancers, it's pretty common, who go through kind of an extreme range of motion, and that can really contribute to some separation. But again, it's usually mild and shallow and very easy to fix. Just like exercise is powerful. it's powerful to heal, but it can be powerful to injure if we aren't aware of how we need to use our bodies well. And then the question of surgery, so it's really like a spectrum. And thank God, just like in birth, thank God there is C-section, right? So we might hope for a VBAC, or we might hope for a non-surgical birth, but sometimes it's really necessary, and that's a blessing, right? That's a wonderful thing. When it comes to diastasis recti, again, the vast majority of cases are of a severity where you can heal with exercise and with sort of non-invasive means. But there are, some percentage of cases, and I don't know what that is in sort of like an absolute statistic. In my personal experience, I'd say it's less than 5%. Where there's just been such a degree of trauma to the tissue that it really is beyond what we can fully resolve with exercise. However, even surgeons who I would refer people to in New York City recommend doing the exercises before and after the surgery, because it really helps have better outcomes and have better recoveries. So it's like, it can be both and. So if there is like a really severe situation, there's no shame, there's no judgment. Like if your body needs surgery, that's great that you have that option, but you can probably get much of that way and have healthier tissue for the surgeon to work with if you do exercise it. And I would typically say, like, even if you know that you have a very severe diastasis recti, I would say give yourself 6 months of absolute dedication to doing as daily as you can those exercises and see how far you can get. And then if there's still like significant separation, then you could start to consider talking to a doctor and exploring other options. But I would give yourself at least 6 months of just dedicated time before. Yeah.
Yeah. So surgery isn't an easy out, right? You're going to be doing the exercises ideally either way.
That's true. You don't avoid the exercise. And, there can be complications. It's a very major surgery. And there's also scars. There's a lot more risks involved with surgery. So it's not to be taken lightly. Yeah.
Well, and you mentioned 6 out of 10 people have some degree of diastasis recti.
Yep.
I mean, that's really common. So there are probably a lot of people wondering, how do I know if I have it? Am I one of those 6 out of 10?
Yeah. So that's a great question, Sarah. And you can actually self-check at home. And I could put a link to a video in the show notes that walks you through how to self-check, because it's a little bit hard to demo fully here, but I'll describe it. So if you're at home and you want to just you're like, well, I want to just have like a ballpark idea. Do I have this or not? Then I would say you want to lie down on the floor or on a mat, something comfortable, but that's firm. So not so much like a cushy bed. So lie on a firm surface, and you're going to bend your knees. You're in a classic crunch position. And then you're going to place your fingers. I would start with 3 fingertips right on the belly button. And the fingers should be pointing towards your pubic bone. So it's like along vertically, your fingers are pointing along the midline towards your pubic bone. And then I want you to lift and lower your head a few times. So you're lifting your head just until your muscles kind of grab your fingers. And what you're feeling for is how many fingers can fit in that space between the 2 halves of the rectus abdominis. If you don't feel something, then try pressing down and lifting your head a little higher. Like ultimately, the accurate measurement is when you're just lifting your head off the mat or off the floor, because that's kind of the moment your muscles transition from passive to active. And we're trying to heal the separation when the muscles are at rest, not just when they're engaged. We want the muscles to come back and to stay back kind of aligned along the center. So that's like the quickest way, like kind of how to check. But you can always, we'll send a video or like post a video with more details. And you can always ask a doctor or a physical therapist or someone to check you. There can also be visual signs. So like if you have noticed that when you like sit up from lying down, that there's like sort of a big bulge or coning or doming right along your midline, that usually indicates that there's some sort of laxity in the tissue there. And that's usually some degree of diastasis recti. And this will typically occur more like late 2nd, 3rd trimester. And then it'll linger for some time after the birth. And sometime could be decades, sometime could be months, sometime could be weeks, and it does not always spontaneously resolve. So that's why exercises help. Anything we can do to help support that tissue and help those muscles like activate in a healthy way will help that recovery happen.
Great. Yeah. And then at the top of the conversation, we also were touching on when and how to do this safely to avoid further injury or to avoid making it worse. So I want to make sure we really cover that thoroughly and empower our listeners to feel confident in how they're addressing this issue, because it is so common, as you're pointing out. And the other thing I'd love to share and hear your perspective on is, can someone address this if it's years later?
Yeah. Okay, great. So how soon and then how late?
Yeah. Yes.
Okay. Good time-based questions. So how soon somebody can start to activate their deep core muscles in sort of this gentle core compression is really within hours of birth. That's how safe and gentle this is. It's, we have an early postpartum path in our app. We also have a post-surgical recovery path. And these are both like for those gentlest early days. You don't have to start that early. Like, I'm not saying you must do this. I'm just saying it's so safe and gentle and restorative that one could do that. It's basically a sort of muscle-based breathing exercise that is gentle and restorative and very safe. It's actually really great for circulation too, especially if there was a surgery. So, and I'll show you what the exercise is. Now, I'm speaking specifically about deep core activation. It's sort of like a gentle activation of the transverse abdominis. I'm not talking about full crunches or sit-ups or planks. Like, none of that is what I'm talking about. I'm talking about just this very gentle, restorative, healing exercise that is accessible to you even within hours of birth. The question, how late is too late? It is literally never too late. One of my oldest clients who I worked with in New York City. So like when I was specialized in pre and postnatal, most of my clients were like in their 30s. They were professionals in New York. And they were like, hey, I go back to work and I need to not be leaking urine. Like, help me now. So that was sort of my primary client base. But then a lot of them had mothers who were also local. So then they're like, you know what? My mom has had like core issues and back issues ever since she had me 34 years ago. Do you think you could help her? And I'd be like, yes. So then I had this sort of secondary clientele that were the mothers of my clients. So then I started to see them. And so this particular woman was a neighbor of a client's mother. So anyway, but she was in her 80s. She was 82 years old, and she had her kids many, many years ago. But she stopped leaking urine. She stopped her back pain. She had just a tiny bit of lingering separation, but we healed that and everything. And she felt great. She was going to her grandchild's wedding and was like, I feel better than ever physically. So like, it is literally never too late. And your body is resilient. This is all living, breathing tissue that can like respond to healthy prompts, so it's for sure something that is never, there's never a deadline like, oh, if you didn't do it before you stopped breastfeeding, forget about it. No, totally not true. Which actually brings to mind another myth. I've had people tell me that, oh, well, someone told me I can't heal DR until I stop breastfeeding because of the hormones. And I was like, that is not at all true. Like, there's no study that will tell you that. And the vast majority of my clients who I helped heal DR were breastfeeding and were actively breastfeeding even while we completed that healing process. So choose whatever is the right choice for you and your baby in terms of feeding. Like, whatever feels like the right thing and the right transition for you is great, but don't feel like you have to make a decision sooner than you're ready because of a musculoskeletal concern. Like, this will not breastfeeding will not hinder healing diastasis recti. So,
yeah, and healing it is not going to hinder the breastfeeding, right? In the
exactly.
Reverse. Yeah.
Yes. Yeah.
Which brings a question to mind then, which I think you've hinted at the answer to. Certainly a female-oriented body throughout life is going to go through day-to-day as well as developmentally hormone shifts and changes. And, We do know that to some extent they, and very, maybe even sort of somewhat individually affect the whole body, the consciousness, the mind, all of the things. But we also are learning that exercise and diet, the old dyad, always can have a positive effect on what otherwise seems to be hormonally induced, right?
Yes.
Not only can exercise help balance your hormones, as will a good healthy diet alongside that, but there's almost never a downside. Because I'm menopausal and older, have a AARP subscription. We're constantly getting articles about, these things are good for your memory and these things are good for your body. And guess what? They go together. They always go together.
Yes. Yeah.
And so, I think I just want to amplify for our listeners that, yes, I experienced that personally. I let it go and then I have to get back on the horse and then I let it go. But it always was better when I don't let it go, or if I remember to do the things, and it affects everything.
Yeah.
Not just one anatomical locale, or one set of sensations that I get to have or not have. It really is quite a holistic thing, which reminds me to say, and that's why I love your app, is because, there are so many modalities to experience this in that are all essentially exercise based, but, you can do a hard charger, aerobic weightlifting thing one day, and you can do a gentle yogically based wonderful thing another day. And it's got it all. It's really great. And at any age. Yeah.
Yes. Yeah. And in fact, we also have some more recent exercise regimens in our app that are specifically for perimenopause and for navigating the menopause transition. And those are focused a lot on incorporating progressively impact training. So you can have that benefit of the bone density. But of course, you want to do that without starting to leak urine. So we help you balance all these things because, there's a lot of considerations. And I will say too that because our onboarding is very specific to where you are in that moment. So if you're early postpartum or early post C-section, you won't be served any of those workouts that Esther's talking about that are HIIT training with Therese and high energy and that sort of thing. That exists, but that will be served to you later when you're ready for it. So if you're in an early gentle recovery path, you will be given some mobility, things that just feel good. It feels so good to move my body through this full range of motion, and to start to reconnect your deep core and pelvic floor and to draw into that breath. It's very soothing. It's very comforting. So it's sort of that. And also so that, because, still most of us go to see our doctor, we're sort of having a birth with a provider. And then that first postpartum visit for many people is still 6 weeks after delivery, right? So then they're like, oh, you're cleared for full activity. And you're like, really? I just went from hardly doing much to now I'm can do whatever. So our early postpartum path, it was actually a very minimally invasive OB in New York who was I wish there was something to guide my clients early on through those first few weeks where they're just really needing guidance and some healthy movement, but we want them safe, but we don't want them just lying around or feeling afraid to move. So that prompted sort of this very early postpartum path that is really just that reawakening of your body and feeling that awareness and how to find those muscles and all those things and just feeling good. And then after you get to that 6-week post delivery, you're oh yeah, and I can activate my deep core and pelvic floor while I do more robust movement. And, it feels all integrated versus it went from nothing to anything,
Yeah. With almost no information, right?
Right. Yeah.
I think that's been a real mind game for so many mothers in the last many decades, that you don't see anybody and suddenly a doctor says to you, well, go home and have sex.
No, thank you.
That's
do I have to? No.
That's all there is to it? No, right? It's way more there's way more potential in that time, and there's way more nuance in that time. And so, yeah, I do appreciate that. And I want to emphasize for our listeners my experience here, which is that specifically that the app has a really nice little questionnaire for you, right? You answer some questions about where you're at and how you're identifying your stage, and it just gracefully shows you what to do. It's not a lot of guesswork. I mean, I use the app as a menopausal person, and it just took me right where I needed to be, which was brilliant.
Awesome.
Yeah, no, it is awesome. Yeah. So very, very helpful.
Oh, thank you.
So if you've had a C-section, or if you haven't had a C-section, or, whatever your particular circumstances are, it's very, very intelligent guidance.
Yeah. And at risk of sounding like an infomercial here, we don't talk about products and services unless we have genuinely used them and love them. So Esther and I both are in that boat with your products. So we can do that, and we will do that. But this is a very rare episode. You don't hear us talking about products and services. It's very rare. And I wanted to go back to something else you were talking about around sort of like the surprise benefits. Like people are going in to solve a specific issue, but you talked about incontinence, you talked about other benefits, but like, let's talk about all the things that people might see on the other side of repairing diastasis recti.
Yeah. So I've referred a couple times to 2 studies. And so I want to talk a little bit about those 2 studies and what we found, because that will be a very specific way of answering this question. And then I can talk more generally as well. But the first study that I did was with Weill Cornell Medical School. And that was through a client in New York. And she was one of my clients who was she was preparing for her first birth. And her OB, I met through the client. Her OB was really interested in doing lifestyle intervention for high-risk patients. And she had heard about me from this client, her patient, and was like, oh, I'd love to know more about your work. We need an exercise professional on this study. So anyway, that started a conversation. That client then delivered her first baby in 15 minutes of pushing. And the OB was like, tell me again about your trainer. I think I really need to bring her in here and get her on this study. So anyway, that kind of created this relationship and opportunity where she wanted to look more specifically and look at all the data for the results I'd had with clients in terms of diastasis recti. And so that study was published in ACOG in their Green Journal in 2014. And in that study, 63 women had fully resolved diastasis recti in less than 12 weeks. The average length of time was 11.24 weeks. And so we were looking at measurements of diastasis recti, the interrectus distance, that was through a manual check on those patients. But then also we surveyed them about urinary stress incontinence. So that's leaking if you jump or sneeze, and about low back pain. And this was a postpartum population, and their rates of incontinence and low back pain were dramatically lower than the national average for just a non-postpartum person. So this was a retrospective study, but it showed us, it was sort of like a pilot that said, okay, something is definitely happening, that when these women are exercising with this intention to heal diastasis recti, and we're engaging the transverse abdominis and the pelvic floor in these very specific ways and coordinating it with their breath, they also seem to be impacting low back pain and stress urinary incontinence. So fast forward to 2021, there's another study that was published. This one was in collaboration with the Hospital for Special Surgery, also in New York. And in this study, they were doing musculoskeletal ultrasound of the linea alba of women who were doing the app. So that first study back in 2014, those were people I worked with individually or in small group classes, live interaction, right? So I could physically touch their bodies and give them feedback. In the second study with Hospitals for Special Surgery, these women had only done the app. I never met any of them. I don't know who they are, but we know that they dramatically narrowed the gap between their rectus abdominis muscles, both when the muscles were engaged and when they were at rest. They also had significant improvements in stress urinary incontinence and in low back pain. And this was a prospective trial. So it was measuring and some of the women, so they did a 12-week study, and some opted to continue an additional 12 weeks. And those who continued for an additional 12 weeks saw even greater improvements in every measure. and there were no adverse events, like nobody was injured or harmed. And 95% of the women in the study said, oh, I'd recommend this program to a friend. So that was a study that was done by Hospital for Special Surgery. And it just kind of illustrates in a very vivid way when we go in to kind of like to focus on reactivating those muscles and reawakening that connection, everything starts to get better. So those are the things that I can say with data and research. We know it also improves stress urinary incontinence. That's the leaking if you jump or sneeze, and low back pain. Other things that we know more anecdotally, and like our pelvic floor PTs will say, yes, absolutely. These same exercises that we're doing for DR also improve prolapse. Prolapse is something where, it depends on the severity. And prolapse, like that's sort of lowering or laxity in sort of that pelvic sling of what holds up your organs. And it can be mild to severe. If it's a real severe prolapse, you're probably going to need some more serious intervention. But if it's mild to moderate, we can help relieve symptoms related to prolapse by adding strength and integrity to the muscles that support that tissue. So once the uterine ligament or once the ligaments are stretched, you may or may not get a real like shortening of those ligaments, but you can add sort of integrity to the muscles and other tissues that surround that. So you can essentially eliminate or lessen symptoms. So prolapse is a little bit more nuanced. And if you're struggling with significant prolapse, I would absolutely see a pelvic floor PT because they can help guide you through your options. But if it's mild to moderate, often people will feel just like spontaneously better because they're doing these exercises. And then the other thing that we do help, and this was not, when we first launched Every Mother back in 2018, we did not have specific programming and videos and exercises for overactive pelvic floor. But we did develop that and launch that, I think in 2020. I don't remember exactly, but we incorporated that into the app with pelvic floor PTs guiding that. Because what we realized is that a lot of women are struggling with overactive pelvic floor. It's also called hypertonic pelvic floor. And that's when the muscles in the pelvic floor are kind of chronically engaged, like in a semi-kegel, like they're kind of like, they don't fully want to relax. And when those muscles are kind of carrying chronic tension, it can lead to various kinds of pain and pain symptoms like back pain, hip pain, pelvic pain, pain with intercourse or insertion of a tampon or just sort of any penetration because those muscles are just like tight and they don't really want to relax and soften. So the main thing that we do to help with that is help your body learn how to relax and release any tension that you might be carrying in those muscles. And so we've now incorporated into the app that will help you manage and relieve overactive pelvic floor symptoms while still engaging the deep core to heal diastasis recti. So you can do both. It's a little bit slower path to full resolution because we need to allow time and space for those muscles to fully relax and release, if that makes sense. I don't have to go into all the details, but all of this to say that if you're feeling like, oh, I better not start to do a lot of deep core strengthening, that might trigger, an uptick in the sort of overactive pelvic floor. There are ways where we can help you both continue to improve and manage overactive pelvic floor while healing diastasis recti. So you can strengthen a muscle and you can relax and release a muscle, and we kind of help you learn how to do that. So you can balance. Ultimately, what we want to do is restore balance to your core and pelvic floor muscles and allow that balance to serve you as you move your whole body through various activities, whether you're lifting your baby, whether you're going up a bunch of stairs, whether you're pushing open a heavy door, or maybe you're more athletic and you're like, I want to get back to running, but I need to figure out how to manage my pelvic floor symptoms. Like we have whole programs to help you return to running safely without going backwards in terms of symptoms. So anything is possible. And we are just here as a guide to help you. And in addition to like giving you programmed paths where it's like, do this, we provide a lot of education to help you understand, well, how can I tell if that's safe or not for me? Because it's not really a black and white list, like never crunch, never plank. No, you do want to plank eventually, but maybe not yet. Like maybe not in this earliest moment when you're still kind of like reconnecting that core and pelvic floor. But how do you know when you're ready? Like this is what we help you kind of understand your body and what symptoms to look for when you're maybe pushing it a little bit too much, when you need to back off, etc. Yeah.
That's an incredible set of research that you've done. and to demonstrate those, with those studies, to demonstrate those outcomes in an actual research study in partnership with very reputable organizations. What do you commonly see as pitfalls or things you want people to avoid injury or doing things too fast? Like, do people come to you and they're like, yeah, my doctor said, at my 6 weeks, I could exercise again, but it just isn't working, or it's painful, or like, what are the things that you hear from people, and what do you want people to not do?
Yeah. Okay, great. So, and I think this pendulum is really swung in terms of what doctors have told patients, et cetera. Like at some point, not too long ago, people were afraid to move or exercise or work out. They're like, oh, I don't want to hurt the baby. I don't know what to do, so I'll do nothing. And then it kind of went to, well, anything goes. If you were doing this before pregnancy, just keep going. And that's not fully true either. So the truth is, like, insight can help us make better decisions, right? And so part of it is listening to your body, like running during pregnancy. There's a lot of various advice on whether or not to run or how long to run into your pregnancy, but often your body, if you're really listening, can help you make that decision. First trimester, you might feel fine. But as you get into somewhere in the second trimester, maybe you have some joint laxity and you feel a little bit unstable, like the ankles might roll, that sort of thing. As there gets to be more and more weight on the uterus and on the uterine ligaments, because the baby's growing, the placenta's growing, there's weight, every impact, every step starts to really pull on the uterine ligaments. And you don't always want to it depends on your life and I just had a call last week with a professional runner. Like, they have a very different sort of perspective on this than a recreational runner who's just running for like exercise. So I personally, in terms of during pregnancy, I chose to switch from running because I love to run. And I'm like, I want to run for the rest of my life. So during pregnancy, after some point in the second trimester, I was like, I feel safer and better, like musculoskeletally, if I switch my cardio to my spin bike. So I'm just going to do hard bikes on this. Some people love to swim. Do what feels good to you. So, but part of it is really listening to your body. And I know it sounds very like general, but it's true. Like your intuition and really kind of dialing into what feels good to me, what feels a little like not good to me, and then responding to that. Like following your body's wisdom is one piece of it. But then from a more scientific standpoint, like, what are things that are shifting and changing that you want to be careful of? Well, one is that there is a lot more joint laxity in your body. This is true during and after pregnancy. And you're at much greater risk of dislocating a joint, or like a sort of, if you're pushing deep, even like prenatal yoga. Prenatal yoga is great. But, if an instructor is maybe like pushing you to go deeper and your body is not quite feeling it, sometimes, you can pull a muscle, or you can cause some like minor injury that would best be to avoid, So you don't want to like really push to try to go to extreme ranges of motion because you're at a higher risk of some joint injury. Often people will feel tighter during like they'll feel tight muscles but loose joints. So, you just want to kind of be mindful so that you're being gentle with your stretches, okay? And never forcing a stretch. In the early postpartum phase, sometimes, and this often depends on person's sort of relationship to exercise. Some people are like, I don't feel like myself unless I'm going at it 110%. Like, I just want to get out the door and go to my HIIT class or go running or whatever. So in terms of like serious impact, jumping, running, etc., the conservative advice that I'm going to give to the general public is avoid like really seriously impact-based exercise until you're about 12 weeks postpartum. Now, if you have been like vigorously, diligently increasing your core strength and pelvic floor, maybe working with a pelvic floor PT, maybe you're a serious athlete and you have that baseline strength and sort of you've already restored that integrity to your deep core, maybe you could start at 6 weeks. But I still, you want to be mindful. And this is what I would watch for. Like, if you go for a run or you go to do like a HIIT class with a lot of jumping or something, if you feel bladder pressure, vaginal heaviness, if you've experienced spontaneous leaking, these are all signs that your pelvic floor is not ready for that level of load quite yet. So then I would just, it's okay. It's not like you just injured yourself, but you just kind of want to respect the symptom and back off a little bit. So you can kind of work up to the edge of the symptom, but then you want to take a step back. So you don't want to push through a symptom. If you're like, oh, I went for like a 3-mile run and I started to leak urine, I'll just go 2 more miles. No, then, your body's like, oh, I can't quite handle this yet. So let's walk. Let's walk the rest of the way home and like take a little break, focus on deep core activation, core and pelvic floor. And then maybe a few days later, you try a light run or a walk run. So I'm not anti-activity, but you need to really like pay attention to symptoms. So that's more like pelvic floor. Yeah. Go ahead.
I want to add in that, I over the years have encountered often people who were in my childbirth ed, and we've come back for, the 3-month kind of reunion or something like that. And I remember once having a couple in my class who, she was older than him, but they were both pretty outdoorsy and active, and here we were, this far postpartum. And she took me aside and said, well, I'm still bleeding. And I was like,
wow.
Yeah. And I was like, well, what's your activity level? And she told me. And I was like, when did you start this activity level? And she told me, and I'm not going to even say it out loud. But I was like, if anything is a surefire sign that you need to slow your roll, this is it.
Yeah.
Yes,
absolutely.
And I, of course, I asked, like, are you having pelvic heaviness? Are you having some of the things that I would expect to hear of much earlier, just as a check on that? And, it could have been purely hormonal, right? Like, it is possible to keep spotting for months because your progesterone levels are so low. But it's also a thing, that if your body hasn't had a chance to become fully, your uterus in particular, become fully patent, you might want to slow down and do your core work, but not take 3-mile runs with your dogs and your baby and everybody else. I don't think she was doing even more than that. But the point being that urinary incontinence is a biggie and we can solve it. But uterine stuff is another level.
Yeah.
And so we want to be really, protecting around that as well. And maybe you need to find out whether there might be something else going on that has nothing to do with how much exercising you're getting.
Right.
Just so that you're not leaking all the time, having to wear a pad forever,
Yeah. And for sure, like bleeding is something where if you're chronically bleeding weeks after birth, you want to talk to your provider about that and rule out other serious things for sure. Or even dizziness and lightheadedness. If you're having kind of extreme dizziness and lightheadedness while you're doing activity, that's a sign you should have that checked out. Maybe there's something going on. For sure. And then from a more musculoskeletal perspective, like I've talked to him and I've been giving I think I was giving a lecture at a health talk to a company, and somebody who was present to the talk, she's like, oh my God, she's like, I was having so much back pain after my babies. My doctor said, oh, you need to improve your core strength, which is true. She did need to improve her core strength. But so she thought core strength, I'll do crunches. So she's like, I just started doing crunches, like 300 crunches a day, every day. And she's like, and I just feel like my back pain got worse and my belly looked more pregnant. She's like, but I had no idea why, because I was like doing what the doctor said, improve your core strength, and everything got worse. But then as she's like learning about diastasis recti, and I'm explaining what helps improve it and what can actually exacerbate it, and crunches are one of those things, she was like, oh. And I was like, I feel like your time is so precious, especially with a young child. And, she was at work and like she was doing her absolute best to be responsible with her body and take care of her back pain and core strength. And what she was doing was literally making it worse. So, I'm not saying you can never, ever crunch again, but there are better ways to improve your core strength. And especially if you're working to heal diastasis recti, these are some signs you want to watch for whatever you're doing. If you cannot keep your belly button drawn towards the spine, so if your abs are pushing forward forcefully, which is true when you do a full crunch and your shoulders come off the floor, and that's not even a question of strength, it's just the mechanics of that movement. If your abs are bulging forward forcefully and repeatedly, that will worsen diastasis recti. Like that can also apply to a plank. Now, a plank is not inherently injurious, and a plank is something you could work up to doing a full plank again at some point postpartum. But I would always start with a wall plank, and you want to make sure you can breathe while you're in that wall plank, and that you're keeping your belly button kind of buttoned into the spine. So it's like little pulses, ha, ha. And you're with control, and you're keeping your abs pretty flat as they can be, versus barreling forward, because you can engage the muscles in sort of a barreling forward direction, but that's going to put a lot of stress on the linea alba, which you're working to heal. So you want to just watch for anything that's like pushing your abs forcefully forward. You want to avoid that. So modify the movement or skip that movement. And you also want to watch for any doming or coning. So that might just be like, oh, like when I do this one part of my belly just like pops out. Then, that's your body saying, don't do that. You can't quite control that intra-abdominal pressure in that spot. So you want to you can give some external support, but you also want to modify your movement so that you're not doing something, whether it's sitting straight up from lying down, that is causing that sort of it's like a lack of the ability to control or manage the intra-abdominal pressure. And that is really ultimately what caused DR, and that will make it worse. That's what I would look for in terms of core exercises. And the one other category, and that's more that'll change over time. Like maybe you had your baby 7 months ago, but you haven't gotten around to exercise. Okay. So you're just starting to exercise. I would not dive into a full plank immediately. I would work up to that. And I also would not dive into a bunch of forward flexion exercises. It's not the best for your discs in your spine, and you're probably going to be bulging forward forcefully, which can again contribute to diastasis recti if there's some lingering separation. And the other category of movement that I would be mindful of is actually an overstretching or opening of the rib cage. So, and this is something that people don't always think about. It's not quite the same load bearing activity, but if you're constantly opening, I'm going to just stand up and show you actually. But if you're doing an exercise, in fact, I had this male client who had done this sort of extreme, he was arching his back when he was doing squats with the weight here. And he had opened his upper abs here from flaring his ribs, opening his lower rib cage under load. But this can also just be from a lot of yoga classes. If you're oh, I love those chest openers. And your ribs are opening, the lower ribs. Those are also kind of very gently, but repeatedly opening the upper abs. And so still you can do chest openers in yoga, but focus more on opening the collarbones and keeping your ribs anchored in neutral versus opening. It's a subtle shift, but it will kind of allow your body to fully heal all the way through the full length of the linea alba versus kind of overstretching that tissue at the top. So, and that's, it's not a huge danger. This is not going to it's not a really dire situation, but if you're feeling frustrated, oh, I feel like everything else is recovering and I'm sort of feeling not quite the same thing up here, you might just want to be mindful about rib flaring and overstretching.
I used to think that doing a deep belly breath meant flaring your ribs, right? Filling everything up like a frog.
Yeah, no. Yeah.
I've learned in my old age.
Well, we're all learning, right? We're all learning this together. And some of the stuff that we thought maybe, or that genuinely was okay pre-pregnancy, we're learning is not, right? You have to unlearn or shift your thinking in some of this stuff. We've been going for a while. I want to see if you wanted to maybe very briefly touch on prevention recommendations.
Yes. Sure. Yes. Okay, great. And it really is, by and large, we can prevent or at least minimize diastasis recti during pregnancy. And it's the same exercises that help heal postpartum. So it's what I call core compressions. It's when we're coordinating the transverse abdominis, a deep core activation, with our breath. So we exhale as we engage. And there's also a spontaneous lift of the pelvic floor. So all those deep core muscles work together, engage as we exhale. And I can give a little more thorough demo in a minute of that exercise so that if you're at home, you can kind of do it with me. But those core compressions are what will help minimize or prevent diastasis recti during the pregnancy, and they are what will help heal post-pregnancy. And I just want to mention a study that I did not do this study, but I know one of the exercise professionals who worked on this study. It was published in 1990. I think it was actually might have been 1995. Anyway, it was in the 90s. It was with Columbia Physical Therapy, and this was following a 6-week exercise class of pregnant women. And in this sample, some of the women were doing like this deep core activation of the transverse abdominis on a regular basis, and the other women were in the non-exercise group. But the people who were in the exercise group were really focused on this transverse abdominis activation. And at the end of the study, the women who were in the exercise group had a much lower rate of DR. It was like 12.5% had DR, whereas in the non-exercising group, it was 90% had DR. And in the exercising group, so they were doing these like essentially core compressions, although they didn't call them that, but they were engaging the transverse abdominis. Those who did have a diastasis recti, it was far less severe. So it was very mild in 12.5% of those women, and the rest of them had no DR. And they were third trimester in that study at the end. And in the non-exercising group, 90% had DR, and it was more moderate. So it wasn't in the mild category, it was moderate. So that's just kind of showing us that our bodies are very intelligent and will respond to the exercise in a way that will help like distribute the stretch of, our bodies need to stretch to make space for baby, but it doesn't have to all take place in one spot, which can cause more damage to that fascia and connective tissue. Our bodies can kind of distribute that stretch in a way that's healthier and easier to recover from. So yeah, and sometimes people have triplets. Sometimes people, a very tall person with a long torso is going to have less DR than a short person with a short torso because there's less space. So things need to stretch more because there's not as much space vertically. So there are just like mechanical things that can put someone at greater risk. So, for sure, multiples, you're at greater risk of diastasis recti than a singleton pregnancy. Or just like sometimes people have excessive amniotic fluid, and that can cause a much, bigger belly, more stretching, and that can lead to a more severe DR. So, there are things we cannot control. So I'm not saying, if you do all the right things, you'll never get DR. No, but you can kind of set yourself up for an easier recovery, for less separation, by kind of taking proactive steps that are really minutes a day of exercise. The great thing is that these exercises not only help you prevent diastasis recti and related sort of pelvic floor, could be leaking, could be prolapse, etc., but these exercises also prepare you for birth. Because ultimately during birth, and we incorporated a lot of this into our app for our pregnancy program, you're pushing the baby out during that active push phase. Like, yes, your uterus is contracting, but you're also pushing with your push muscles. And like if you think about a toothpaste tube, you want to kind of push from the back of the tube and you want to take the cap off, right? You want to release the pelvic floor. So sometimes we might have a lot of core strength, but every time we clench our abs, we're clenching our pelvic floor closed. And that is actively working against yourself in birth, right? So when we're training for birth, we want to actively and like incorporate on a daily basis a habit of relaxing and releasing the pelvic floor, softening the pelvic floor, opening the pelvic floor as we engage with strength in our mid to upper abs. And that really kind of helps your body have that muscle memory. So in birth, you can have a very efficient and safe pushing experience because your muscles already know how to coordinate. So yeah, there's a lot of benefits to training your core during pregnancy in a way that is both mitigating any musculoskeletal stress on the body, helping you feel better, helping with posture, and also helping you prepare for birth with strength.
I know we don't have much more time and we want to wrap up, but can you quickly speak to squatting? Like, getting into and out of a nice deep squat just for relax. I mean, all my life I've been squatting to relieve lower backache and it works.
Yeah.
Great. And I think it's lots of benefits that who knew. And I can still do it at 66 and I plan to still be able to do it at 93.
Yeah. So I love a deep squat, especially as you're getting ready to give birth. And as you're talking about, like in terms of like when you're going to the bathroom or when you're birthing, like when we get into a full deep squat, it increases the opening, like the pelvic outlet opens, I think 28% more than when you're just like in a seated position. I don't, don't quote me on the exact percentage, but I know it's significant. So it's a great position for birthing, and you want to know that you can get into it. It also just like helps release and open and gives you full mobility in like the hips and pelvis. And sometimes too, when we're trying to engage our deep core muscles, our glutes try to fire and our glutes kind of take over that action. If you can get into a deep squat, your glutes are in a stretch. Like they're kind of, they're in this position, so they can't quite activate in that same way. So they kind of allow you to activate the pelvic floor a little bit more clearly in isolation versus like my glutes are doing it and I can't feel what's going on. So there's a ton of benefits to doing a deep squat. I would say like what I usually tell my pregnant clients, and I'll just see if I can show this a little bit, but is like you want to hold on to like something stable. I'm going to hold on to my dining room table. But you want to have, like, you could also use a banister or any heavy piece of furniture, but you kind of want to like be able to lean back and then get all the way down and feel comfortable. If it feels like your ankles are not quite, I know you can't really see me that well, but I basically squatted down, and sometimes people feel better with a wedge under their heels, or you can roll up a towel and put it under your heels. But then I don't want you to get up out of it because I'm in a really deep knee bend. So I don't want you to just stand straight up. That might be a little bit much on your knees. So I always just have people like just sit down to get out. So once you get into that deep squat, and you could do that for like, start with maybe 10 seconds. And if you feel like you can go to 30 seconds, up to 1 minute, like it's just so healthy. And while you're down there, you can do core compressions or you can do some Kegels. But then when you're done, don't stand up from that deep knee bend because it just might be too much on the knees. So instead, sit down, and then you can get up. There's a lot of different ways to get up. I'm going into all fours, and then I'm just going to lunge up to get up. But that deep squat is a great position. During labor, I tried getting into a deep squat like pretty close to the birth, and I was like, whoa, that's too much pressure. Like I was like, I need to be on all fours. So, I mean, listen to your body. It might be a great position for one stage of labor, but it might feel like you're not ready for that much pressure. Yeah, it's a great position, which we also include in the app and guidance on how to get in and out. So, yeah, it's a great thing to incorporate.
Thank you.
Sure. Well, we're going to wrap. We've covered so much ground. Thank you, Leah and Esther. And I also want to mention that if people are interested in trying the app, they could go to fourthtrimesterpodcast.com/everymother for 10% off. And you can use the code Fourth Trimester on the Every Mother website. If you go directly, you can just, at the checkout stage, you can enter a coupon code. So it's FOURTH, trimester, so fourth spelled out, and you get 10% off the app. So thank you, Leah, for letting our listeners have that nice little perk. And we are going to sign off now. Unless you have any final thoughts that you want to share, Leah, with us that you have not covered, I invite you to do so.
No, thank you. I feel like we've covered a lot of ground. And yeah, thank you so much for this opportunity.
Great. Okay. Thank you so much.
Thanks,
Thank you.
Sarah.
You can subscribe to this podcast in order to hear more from us. Thank you for listening, everyone, and I hope you'll join us next time on the Fourth Trimester. The theme music on this podcast was created by Sean Trott. Hear more at soundcloud.com/Sean Trott. Special thanks to my true loves, my husband Ben, daughter Penelope, and baby girl Evelyn. Don't forget to share the Fourth Trimester podcast with any new and expecting parents. I'm Sarah Trott. Goodbye for now.
Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I'll sing a song for you. You got your wheels, you got your gears. You ride around town without any fear. You got your pedals, you got your brakes. You always wear your helmet for safety's sake. Hello again, bicycle man. I know you're doing all that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you. Hello again, bicycle man. I know you're doing the best that you can. I wrote the song, simple and true. I wrote the song, I sing a song for you.